So we are going to get started on our webinar. Thank you to everyone who has joined for the OCFS Community Conversations on Military Childcare tonight. So I'm going to get started and go over some housekeeping items. All right, so for those who would like to listen to the presentation tonight in Spanish, you will go to the bottom left of your screen and you will click on the little globe and you will switch the audio floor from the original audio over to Espanol. And then once you do that, you will have a sliding bar. So if you would only like to hear it in Spanish, slide the little dot all the way to the left. And you will only hear Andreas tonight be interpreting. But if you leave it in the middle, you'll hear both the English and the Spanish room. And then you can move it all the way to the other side if you want to hear in English. Some housekeeping items, all the lines are muted. We encourage any questions that you may have. So if you do have any questions, you send them to the Q&A box and the panelists, will be able to look at those for you and do those during the presentation. And the presentation is being recorded tonight and it will be shared on the OCFS website. So I'm going to hand this over to Emily, who will go over our agenda for tonight.
Thank you, Sarah, and good evening, everyone. Thank you so much for being with us this evening. My name is Emily Meyer. I'm Associate Commissioner here in the Division of Child Care Services at the New York State Office of Children and Family Services. For tonight's conversation, we're going to have a community conversations overview. We'll follow up on some of your questions. We have a great presentation about military childcare in your Neighborhood Plus program. And we'll end our conversation with news you can use. Next slide, please.
Yep.
To kick us off tonight, though, we want to start with a Slido. So if you can all take out your smartphones and scan the QR code using your camera on your smartphone and join us at the Slido. Our passcode is DCCS. And we have a couple of questions just to get a better understanding of who's joining us this evening. So this is just who's in the room. Are you a center director, a family child care provider, a group family child care provider, a SAC program, a legally exempt provider? Just want to get a better understanding of who is in the room this evening. And we'll just wait a little to have more responses come in, but it looks like we have a strong representation of other, which would love to know what those others are, but lots of other, but we also have a strong representation from our family child care providers, some group family child care providers, after school, really wonderful. But don't worry if you weren't able to get to that first question. We have a couple more questions that you can participate in.
Emily, just let me know when you would like me to move over to the next questions.
I think we're okay to move over. So just, now that we know who's in the room in terms of what modality you may be representing here tonight, also just want to understand better where you are regionally. Are you in the Albany region, Buffalo, Long Island, New York City, Rochester, or Syracuse? So great, we have a pretty even split between Albany folks and Westchester folks, so that's great, but also see Syracuse represented, as well as New York City, Long Island, Buffalo. No one from Rochester. But that's great. You can, participate in the Slido at any point during these next few slides. We just have a couple of more questions. I think, yep. So just to have want to have a better understanding, because the topic of a presentation for tonight is the military child care program. And so I want to just see, do you currently have any children in your program whose caregivers are active duty military, guard, and or reserve members? So definitely seeing some yeses, which is wonderful. Some unshores, some nos. And I think, our presenters will be able to provide some great information about how you may be able to help provide childcare services to this population, which will be wonderful. Right. And then our last question is, if you are a childcare provider here tonight, do you participate currently in the military childcare in your Neighborhood Plus program? And if you answer no to the question before, or you were unsure, you may answer no, which is totally fine. The point of tonight's conversation to raise awareness and education about this program, but just was curious if there was anyone that was currently participating in the program. Not sure if we're going to get any more participants, but I think this is a timely conversation then for us to have this great presentation this evening to raise awareness about the program. So Sarah, if you can move to the next slide, please. So just want to give a reminder about the community conversations format and schedule that we will be having here at DCCS. Next slide, please. So our community conversations, which are these webinars, they will continue to occur on a bi-monthly basis. We will continue to have interpretation available in Spanish. And as always, please feel free to send questions or future topic suggestions to the email at this link with the subject line Community Conversations. We want to hear from you what would be most helpful, and always want the opportunity to answer any questions that are top of mind. And as Sarah mentioned at the top of the meeting, we will always record these webinars and post them on the OCFS website at the link listed here on the slide. Okay, so in the spirit of what I just mentioned, following up on some questions that we did receive in the mailbox or from previous webinars, we did have one question that we wanted to answer this evening. So the question came up, does community conversations count towards training credits? And the answer to this question is that this optional call does not count towards training credits. We hope providers join to hear these important updates regarding New York State child care. So just again, the optional call, our community conversations bi-monthly calls do not count towards your training credits. But we do hope that you continue to join us to learn about new topics and to always hear updates about New York State child care. And with that, I'm going to briefly turn it over to my colleague, Jim Hart, who is going to introduce our presenters who are going to present about military childcare. So thank you, and Jim, passing it to you.
Thank you, Emily, and good evening, everyone. At this time, I'd like to introduce our presenters from the Department of Defense who are joining us tonight. We have Program Analyst Nichelle LeGrand Murphy and Project Manager Muja Latif. Nichelle and Muja are going to provide an overview of the Military Child Care in Your Neighborhood program. It's a program that we're excited to be participating in, and hopefully their presentation will provide a great deal of information for you to learn more about this exciting initiative. So with that, I will turn it over to Nichelle and Muja.
Awesome. Thank you so much, Jim. And I hope everybody can hear me clearly. Am I good? All right. Awesome.
You sound great.
So as stated, my name is Nichelle LeGrand Murphy. I am in the Office of the Military, Community, and Family Policy, Child and Youth Programs for the Department of Defense. We actually operate a fee assistance program working with our military service branches. So tonight we'll be able to share some information. Next slide, please. Both my colleague and I, Muja Latif, will share information on the fee assistance program with its name as Military Child Care in Your Neighborhood. And then we'll also share the PLUS program, which expanded from the MCCYN, as we acronym everything in the military. Our MCCYN Plus expanded from the MCC, the traditional fee assistance program. So I'll be able to highlight that information. We'll also share with you information about militarychildcare.com, which is a request for care system for our military families, and how you can become a part of the DoD provider network. And then we'll also share some marketing materials for stakeholders that is available as well. Next slide. So first, I want to give you a little bit of background about military childcare in your neighborhood. First and foremost, this program has been around for more than 20 plus years. Our Department of Defense fee assistance program, it is managed by the military service branches and the Marine Corps, Army, and Air Force contracts with the National Organization of Child Care Aware of America for this particular fee assistance program. The Navy is the only service branch that manages their own fee assistance program in this particular, for this particular program as well. Who's eligible, or what families are eligible for this program? As stated earlier when they asked the question, those families include active duty members, also Guard and Reserve activated on active orders or duties, technicians, DoD civilians, and Gold Star spouses who are stationed at an installation that has been pre-identified as fee assistance eligible, or do not live near a DoD installation with a child and youth program. Military childcare in your neighborhood, as I stated earlier, it expanded in 2019 to MCCYN Plus. And the reason why is because we needed to find a way to qualify those providers who would actually be able to participate in our fee assistance program. We wanted to expand the more amount of providers that could be participating. As part of both MCCYN and MCCYN Plus, there are eligibility requirements. The community provider must first, they have to be state licensed. They also have to have a completed background check, as well as adhere to an annual state or where the two programs differ. Thank you, we're still on that slide. Where the two programs differ is based on whether the provider is either nationally accredited or participating in a state quality improvement system, such as Quality Stars New York. MCCYN, the traditional program, qualifies community providers with national accreditation recognized by the Department of Defense. MCCYN Plus qualifies community providers participating in a state quality initiative such as Quality Stars New York. Now, what's different about New York State and New York City when we launched this program last September was that when Department of Defense reviewed the licensing regulations for both the state and the city, we found that the licensing regulations were comparable to meet or exceed the Department of Defense's standards. That was remarkable because there were 14 other states that were participating, and New York came in as our additional state, but the first state to ever be recognized by Department of Defense as having strong licensing regulations. So you ought to be proud to be providers in the state of New York and New York City. This was the first time ever that a state would be able to have license-only providers participate in our fee assistance program without requiring the military family to request an exception for a licensed provider to participate in the fee assistance program. Next slide, please. Oh, I'm sorry. Sorry, let me back up. This is where we talked about, I'm sorry, I should have had you transition, but this is where we talked about the comparability of MCCYN and MCCYN Plus. So just to recap, this particular chart shows you between the two programs what is required for the provider. So this is where I was showing you or talking to you about what's required under MCCYN and MCCYN Plus for a provider. And the only difference between the two programs is that one provider will be required to be accredited, where another grouping of providers can actually participate in the QRS. But now, as I just finished sharing with the state of New York, all providers across the state of New York, whether you are participating in the QRS or accredited, if you are licensed by the state of New York or licensed by the city, you can participate and qualify to be eligible for the fee assistance program. Just want to clarify that. Thank you. Next slide, please. Now I want to address some of the confusion around how fee assistance is calculated. First, you need to know that families that the fee assistance program is available to our families that are stationed within the continental United States, Hawaii, and Alaska. And the fee assistance program serves children birth through age 12. But then there is also a provider cap, which is shown on the screen now. The provider cap is the amount of fee assistance paid directly to the provider on behalf of the military family. In 2024, DoD increased the provider rate cap up to $1,800 per child per month. The reason why was because with a higher provider rate cap, families may qualify for higher amounts of fee assistance, especially in low-cost locations, such as New York and New York State and New York City. Next slide, please. One of the misnomers that we have found when talking to families and also providers is the misunderstanding of how fee assistance is calculated. First, what you need to know is that community-based fee assistance is calculated using a combination of total family income and an established provider rate cap per child per month. The total family income is used to determine the military child care fee that would be paid on an installation if the family was able to secure child care. Families only pay their military child care fee when the provider rate is at or below the cap, the provider cap. Families pay more than their military child care fee when the provider rate is above the provider cap. On the next preceding slides, I'm going to show you two examples of how fee assistance for military families is calculated. In our military system, there are 11 income categories for military families. Both examples that you will see on the next preceding slides will show when the family's total family income is in category 10. Next slide. This first example shows if the provider charges at or below the provider rate cap, the family only pays their military child care fee. However, if you look at the bottom of this particular slide, you will see that the provider will receive $655 on behalf of that family for the fee assistance. That is what the government will pay to that provider through whether it's Child Care Web America, which is the service provider for 3 of the service branches, or it will be the Navy fee assistance team. So whichever one, they're the ones that will actually calculate and process payments for those providers. Next slide, please. In example 2, you're going to see if the provider rate is above what the provider charges, above the provider rate cap. So next slide. In this particular example, you will see that the provider rate is above the provider cap. That means what the provider is charging. The family in this example will actually pay more than just their military fee. And at the bottom, you will see that the provider will receive $755. So this shows you basically a clear understanding of how that calculation for whether that provider rate is charging below the provider cap or either above it. So that way you have a clear understanding of how our calculations are. So in this particular portion of this presentation, I want to pause here if there's any questions coming through the chat on what I provided or shared thus far that I may need to clarify.
There's just one question in the chat. I believe you answered it, but Jennifer states that she has 2 military kids that need funding. But I think you went over that during your presentation.
Yeah, so when she says she has, that means she has 2 military children in care.
Correct. Yes, I believe that's what she's referring to.
Yes. So if you have 2 military children in care, that means when we're calculating the fee assistance, that fee assistance is going to be paid per child per month. So hopefully that answers what your question. The one thing that I do tell providers, because we've had this conversation in multiple other states, is that the fee assistance that is provided through the Department of Defense and the military service branches is sometimes a little bit different of how it is executed by the state subsidy. But if you can tell that whatever the provider is charging, that provider is going to get the entire the entire fee paid. So that means whether there's always going to be a portion that is going to be paid by the family, and then there's going to be a portion where the government or the fee assistance is going to actually make up the difference. Hopefully that clears up too any misnomers. All right, any other questions before we move forward?
I don't see any other questions at this time, so I think we're good to move on.
All right, so since there are no more questions, I will turn it over to Ms. Muja Latif, who is the Communication and Marketing Director for MilitaryChildCare.com, or what we know as MCC, and she will begin the second portion of this presentation. Thank you very much.
Thank you, Nichelle. Okay, hi, everyone. Yes, I'm Muja, and as Nichelle just spoke to, I do oversee all the communication and marketing for MilitaryChildCare.com, and that includes all the programs that we offer. So tonight we're talking about military child care in your neighborhood fee assistance program. So I'll try to make sure I go back and link everything back to that program. But we're also here tonight to increase awareness about MilitaryChildCare.com. So this is a website. It's open to the public. You do not have to be affiliated with the military to come to this website. We have plenty of what we call public pages, meaning you don't need to sign in. I'm even going to do a little demo tonight and show you those pages and some of our resources. So just to take a step back, what is militarychildcare.com? It is a Department of Defense website that provides a comprehensive childcare system for all of our military families. So we like to think of it as a one-stop shop. So all military families who are in search of childcare must start their journey on militarychildcare.com, meaning they come in, they create a request, and they let us know that they're in need of childcare. We have 233 installations. We have childcare programs on our installations around the world. But we are partnering with you because we do not have the capacity to serve all of our military children. Many times our families are living away from an installation, and so they can't access childcare at the installation because of distance. But also, many times it's because of capacity. We simply don't have the space. And so when Michelle spoke to earlier, that is what birthed military childcare in your neighborhood, which, like she said, started nearly 20 years ago. And the expansion of that program hasn't been as long, but that's military childcare in your neighborhood plus. And what that did was look at your quality ratings in your state and allow us to qualify more providers to be eligible to support our families and receive military fee assistance. And as Michelle said, because you're in the state of New York and you have, really great licensing requirements, many of you are already eligible simply by being licensed with your state. So that is fantastic. So if you're on this call, you like what you hear, you want to know how do you get started, whether you have military children in care now or not, I'm going to share with you some marketing materials that we're happy to share with you. I'm going to share with you how your programs can be displayed on our website. And so if you're interested, we'll, help you make that connection to get to serve military families and their children. So as I spoke to this website, what it does is for our military families, some of the benefits include making this a consistent and easy request for a care process. Prior to militarychildcare.com, our military families had to learn several different processes. So depending on where they were stationed, different installations managed their childcare waitlist differently. So our families that moved quite a bit had to learn a new system every time they move. So now this is a standardized process. All of our families use one system and they all do it the same way, no matter where they are in the country. So that's one of the other, the main benefit for militarychildcare.com. And also it offers all of the childcare options in one place. So like we said, we do have military childcare programs on our installations. We do have fee assistance programs, which is military childcare in your neighborhood is our big one. And we're constantly expanding and adding new programs. The latest is childcare in your home, which is a nanny program in which the Department of Defense does help assist our military families with the cost of a nanny that comes into their home. And so I do get to help market all of those programs and make, and showcase them on militarychildcare.com. So that's the first slide here. I go to the next slide. Many people ask when we do these presentations, where do military families live? And really our answer is always everywhere, literally everywhere. But we're going to focus on the United States and just know that wherever military families are at the moment, our military families typically move on an average of every 2 to 3 years. Okay. So just to keep in mind that if you say, I don't really think I have a military where I live, they could be coming soon, right? You could have families that come for different reasons. Even if you don't live near a military base, we have families where when a spouse is deployed, meaning that they're, overseas in active duty, sometimes war situations, the spouse home with the children will move close to family or they'll move where friends are. So no matter where you are in the world, a military family could show up, right? Our families are everywhere. And if you're talking about the spouse and children, sometimes you won't recognize them because you may never see them in uniform, right? Because the sponsor is usually the active duty member. So don't just make the assumption that I live where there aren't any military families. You don't really know. And that's what we're trying to do a better job with marketing so that our military families can find you and let you know who they are, right? Because it's really hard for you to identify them if you're seeing military and they're out of uniform or they're the spouse of the sponsor. So we do want to help you put posters up or have brochures. And so a military family will always identify themselves as a military family. If they see a brochure that says that there is something special that you offer for military families, they will ask you. So we need to just make that connection there. So this gives you a quick snapshot of what we're talking about on militarychildcare.com. We have over 300,000 households. Okay. And within that household, so the number of households with at least one active request, meaning that out of that 300,000 households, they have at least one request for childcare. Okay. And 50,000 is the number of children with at least one active request. And this is on average. We don't really update this slide because the numbers vary, but we find that they haven't really varied enough for us to change this. So this is also give and take at time that fluctuates, right? So this gives you an idea of the size of the population we're talking about. So pretty massive. So next slide, please. Some people want to know, like, what's in it for me? Why do we want to participate in military child care in your neighborhood, this fee assistance program? And I always put it at the top, and we go to conferences, Nichelle and we are, out here trying to recruit providers. We want to be very transparent with you. We want you, right? We need you to help bridge the gap to make sure that our military families have care. And so when we look at the benefits, we like to just pause for a second and really think about what you're doing. You're giving back first and foremost. Okay. It's about this is a valuable service that you're providing to our military. Anyone on here who is a parent or a grandparent or aunt or uncle, you understand the connection between being able to go to work, of peace of mind, knowing that the people that you love are well cared for. And children are a vulnerable population. And so you want to know that they're in good hands for you to focus and do your job. So imagine if your job was, an active duty service member. It's pretty important that you are clear-minded and feel really good about where your children are so you can focus on your job. You all help us make that happen. So that I just like to kind of start with that because it just resets, right? And so some other things, because at the end of the day, you are a business, and we do get that. We understand that. So also, if you think of it in terms of free marketing, our website, as I said, is a global free website. And I'm going to show you in a moment all of the providers that participate with us. Their programs are displayed on militarychildcare.com. That means that 300,000 households that I told you about, if anyone's looking for childcare at any point in time, they'll see your program. So if they're looking for childcare in your area, your program is on our site. For FCCs, because we got a lot of FCCs on this evening, we don't show your home address, but any contact information that you allow us to share, we will share it. So your phone number, your email, if you'd like. Currently, we don't do email, but we did another presentation, and we were told by some states that some of the FCC providers actually would like to have more of their contact information displayed on the website to make it easier for folks to reach them. So we would work with you, and I'll give you more information. So you'll see that many of you already probably are going to be surprised that you're already on our website and already just displaying to families. You would have received a welcome letter in your email when that happened. And so if you missed it, you'll be surprised if you go out to that website that you are already there. So another benefit that we're also really hoping that this partnership allows is that you reach new customers and increase business. Okay. So lots of benefits for you to come and join and be a part of the network. Next slide, please.
Muja, if you don't mind, can I jump in real quick?
Yes.
Sorry. And one thing too, just to let you all know, so we pulled some data because when we launched MCCYM Plus a year ago, this time last year, so New York is coming up on a 1-year anniversary of celebration for MCCYM Plus, but there are 195 providers. So when Muja is starting to show you the website, there's already 195 providers across the state of New York and the city of New York that are actually participating and already receiving fee assistance on behalf of a military family. There are 297 families that are enrolled in MCCYM Plus currently, and there are 370 children being served in the state and city of New York as well. So just wanted to share that data with you all. Thanks.
Yeah, that's awesome. Thanks, Nichelle. So here, how do you join MCCYN Plus, right? And join the provider network. So just to go over this process and how it works today, we've streamlined it. So military childcare works with DoD, which is really, you all are seeing us live and well. So I work with Nichelle, who you're with this evening, to obtain your state lists, which gives us your quality rating information. And as Nichelle stated, and I have mentioned this evening, because your state licensing requirements are so quality, I would say, I was gonna say strenuous, right? But they meet our DoD quality. So by being licensed in the state of New York, you're meeting the MCCYM plus eligibility. So that's pretty fantastic. So we do still get your list of providers sent over to us. And then that data is made available on militarychildcare.com in a section that we call our provider our DoD Child Care Network. So I'm going to even show that to you in a moment. And then the way that works is our families come into our website, because as I said, all military families start their child care search on militarychildcare.com. They cannot utilize child care on a military installation. They then are forced to go into the community and they will search community providers. They'll see you and they'll find you, right? And then what happens is that the family lets us know who they want to use, and one of our program administrators will reach out to you to get additional information. Okay, and so Nichelle also spoke to this. We currently have 2 program administrators. The Navy administers this military child care fee assistance program in-house, and Army, Department of Air Force, Marines contracts with Child Care Way of America. And I see Nichelle nodding. Okay, because I didn't want to make sure I didn't miss anyone, but that's why we're here together. Okay, fantastic. So the next slide really just lets you know that we collect your state information. If you can go to the next slide, please. Your state information comes over to us once a month. And we add any new providers that have joined the state of New York quality program, right? And so what happens each month, you all should be, if you're new, you would have gotten a welcome letter before your program became visible on militarychildcare.com. And if for any reason you want to opt out, you don't want your program to show on our website, there's a process that's included in that email that we send to you, which is really just an email address that you send that actually comes to me. Don't tell anyone. And then I go in and I make sure that you're not visible on militarychildcare.com. We understand, especially for family childcare providers, once you're full, you're full. And we understand that. So most requests that I get are just that providers are full and it's really hard to manage the influx of phone calls that they're receiving when they know they don't have care, and they don't want to manage a wait list because that's not realistic for them. So they're asking for us to just not display them. If for any reason you're going on vacation, maternity leave, you just don't want your program displayed, you simply let us know and it's a toggle in the system. We can just not display you. You can still participate. So if you've got your program is full of military children, by you saying that I don't want my program to show anymore, it does not affect your current status with us. You can continue serving the families you have. You don't ever have to display again if you don't wish. But at any time, if it was short term because you were maternity leave or vacation or something like that, and you were ready, you just wanted us to take you down for a short period, you can let us know. You can even send me an email and say, please just don't display me between this date and this date because I'm going to go on a long-term leave of absence, and I don't want families contacting me during that period. So we try to work with you as close as we can, make sure that this doesn't become an inconvenience in any way. We want it to be beneficial to us as well as to you. So we do keep an open line of communication. So please, utilize that.
And then Muja, real quick, I'm gonna jump in. So the list that Muja is talking about are those providers that are actually participating in Quality Stars New York. We receive those lists automatically, so those providers wouldn't have to let us know that you're participating. However, because we expanded the plethora of providers to also license only, those providers, we're going to show you on the website how you would actually request to apply to participate, because that's a different process.
Thank you.
Thanks. Mm-hmm.
Yeah, thanks for pointing that out. Okay, and our next slide, I'm going to show you, it's in print, and then I'm going to show you in real life, right? So what does your provider profile contain on militarychildcare.com? We have your provider name, your website, if you have one, the physical address, unless it's a family child care and it's your home address, we may not show that, and then a phone number if you provided it. So we do have here the note, like most times for email addresses, we do not display those. And at this time, we just don't. But we do use them internally. So if a family wants to use, they found your program online, they let us know they want to use you for fee assistance, we might need to reach out to you to get bank information. I do know both program administrators heavily encourage like direct deposit. I do know that they both have a capacity to send by check, but we do know for sure you're going to get contacted for bank information and to set up the payment. So there's no way around that. So we've tried to do as much as we can with verifying all of your documents online, especially being part of MCCYN Plus. We're getting your information directly from the state, but you will always have some paperwork because we need that financial information. Oh, but keep in mind that we only have 2 program administrators. So once you have completed all your information with both program administrators, then it's easier. They just contact you periodically as things expire, right? If your license expired or, or you had a rate change, it won't be, it's kind of like, paperwork up front, and then they'll just contact you periodically. But there really isn't this ongoing kind of bothersome need for paperwork. And many of you are familiar with like your state subsidy programs. You probably have done something around like attendance form or attendance sheet for your I call them students. I'm so used to the school year, but the children in your care. So you would have to do something of that sort. But we definitely would work with you individually and explain step by step what you're getting into and what responsibilities you would have. And like I said, we work with you really closely to try to alleviate as much as we can. We do not want this to be a burden. And we're working every day. And when I say every day, even today, we had a 4-hour meeting. We are working every day and working really hard to streamline this process so that it's really easy for families and providers. So we're getting better and better at this so that you all will say, oh, it's so easy to be part of MCCYN. We're getting there. So the other information that we share on militarychildcare.com are quality indicators. So if a program has one of the DoD approved accreditations, we have an icon for that. If you are participating in MCCYN Plus, you have a little icon for that. And if you are simply just enrolled in your quality stars, we have that. But because again, your state's a little different, most of you, if you were enrolled, you were already approved. So we don't need to make that distinction, but you'll see it for the other states if you were to visit the website and poke around. So that is where we're going next. So while you can go to the next slide, Sarah, if you don't mind, and I will transition to the website. So give me a moment.
And I do want to just do a time check. We have about 10 minutes left.
Okay.
And I do want to
appreciate
give
that.
the OCFS folks some time to share updates that they need to share out to
Okay, good.
attendees.
Okay, I'll do a very quick demo. Okay. I don't think there are any questions. Okay, so I'm at militarychildcare.com, and you can get here simply by typing www.militarychildcare.com. And because of time, I'm going to be extremely brief. So I am going to ask that you all, visit the site on your own, and then you'll have our contact information. If you have questions, we can reach back and help guide you through any questions you have. And we're asking you, if you come across military families, point them to this website because this will have to get started. So we have information about militarychildcare.com. I've kind of already given you guys a brief, some support for families, and then work with military children. This is where you all will spend some time. We have become a family child care provider. this is for the military. So if anyone was really right outside of a military gate or, you know, on a military installation and wanted to become a family child care provider, that's who we're talking about here. Becoming a community-based provider, that's where you all would fall. So I'm going to go ahead and click that. So this section talks about joining the DoD Child Care Provider Network, as Nichelle and I have already spoke to. Many of you are already part of Quality Stars. You're already in the network, okay? But when you do have time, we ask that you come in and check out this video. It's a nice recruitment video. Tells you a lot about the benefits, similar to the presentation I just did, but it's a lot cuter and fun. And then if you are not in Quality Stars, we actually are not getting your information. So you would need to get started here, which means you would just, you know, click this link here. There is a quick interest form. This takes probably 5 minutes to fill out, and this will come directly to our team and we'll get you qualified and get you started. So again, if you're not already in Quality Stars, because that's who sends us the data for New York, then you would need to fill out that form. So I am going, that's all I'm going to show you with that. I just want to show you a little bit about what this provider network looks like. So this is our search for care, and I should have looked up a New York
Here, I'll
zip
give you
code.
one. Put
Thank
in
you.
12309.
Thank you. Okay, so what you're going to see here is I put in a zip code. It defaulted to a 15-mile radius. So it's using this zip code as a midpoint and then 15 miles around this point here. So also if I wanted to, if I look down here and I see I have 120 providers, if I said to myself, that list is just too long, you know, let's refine that list. I could filter and look for just military operated programs, meaning programs that are operating on a military installation or base, which is more commonly used, sorry. And then, or if I just want to look at accredited providers or MCCYM plus providers, I could use these filters here. But I'm going to go down and as is and leave this for the sake of time and show you some more details. So here, because it's New York, all of these providers are showing as MCCYN plus because we've probably gotten them from your Quality Stars team here, right? So all these providers are here. And because we had so many FCCs on, let me see. Let me see if I can find FCC provider. But okay, for the sake of, so please, we do ask you visit the website, poke around. We were having some issues with it today. So if you're not able to reach it today, please do try back tomorrow. We are having some connectivity issues. But for an example, this is what a provider profile will look like. You have your name up large, the physical address. This one, the family would have to Google. So we probably did not get your phone number from our report that we get from Quality Stars, but here's one that has the phone number and the website and the address and the name. So this is what gives you an idea of what the provider profile looks like. And then for our families, we have this feature where they could click on here. They would get an Excel workbook with all these providers put into an Excel workbook that they can even print off. They can keep notes. They can visit different programs and keep track of who they visited and write notes for there. So I'm going to keep this brief for the sake of time and turn this back over to Sarah. And Sarah, while you're taking this back over, I'm happy to take any questions if there are any.
Thank you all for your time. We appreciate it.
Thanks. And so additionally, there is some marketing that I was going to go back to, but I think what we'll do is make sure that we're sharing those materials with you, or at the end, if there's any time, Sarah, you could pass it back over to me. But if not, I feel like those marketing materials we can just get over to you and you can share them with providers if that works as well.
Okay, I am gonna move on to the next slide, but I don't think we'll have time to pass it back. We do only have about 5 minutes left, and I know the
Sure.
OCFS folks have some stuff
Okay.
they need to also discuss.
Okay, sure. So I'll share it with you and we can distribute it another time. So I'll go ahead and end here and pass it back over to your team.
give me 1 second and I will jump over to the slides for that group and I will pass it back to, looks like it's going to go to Jim and or maybe Emily as well.
Great, and thank you both so much for all that information. There was a lot of great content there, and yes, you can share your materials with us, and we can, have a way to get that out and make that accessible to our provider community. So again, thank you both so much for joining us tonight. You're welcome to stay on. You don't have to. I know we're kind of close to the end, anyways, but thanks again.
Thank
So
you. Have
just
a good night.
Couple quick updates. And Sarah, if you can go to the next slide, please. So texting, some of you may be aware, but one thing we wanted to announce is that we are in the middle of a pilot project to work on the ability to text message childcare programs across the state. If you could go to the next slide, Sarah. So we launched a pilot. We did one round, and we are in the process of doing a second round of the pilot and testing of this project. So we're really excited about this. It's a way to really just be able to communicate things in a very timely manner. We don't envision using it for lengthy communications, but we could send a text message that has a link or a message that says, please check your email for important information from OCFS, or check our website for important information. So we're really excited to be able to hopefully move forward and fully implement this once we're done with our pilot. We have been piloting with a group of programs that have been pre-selected. As I mentioned, we're going into phase 2. In order to participate in this program, when we go to launch this in the future, and at this point, given where we are in the calendar, it may very likely be at the early part of next year where we look to launch this option for all programs to participate in. In order to do so, we will be sending out via email a form where the programs opt in to participate. So you will not get text messages from us unless you opt in to participate in this initiative. So just wanted to say quickly, stay tuned in the coming months to learn about this. We're excited about it. We think it's just going to be another way for us to have timely communications with programs across the state. So far, the pilot has been going well, working out some small details. And hopefully phase 2, we are almost 100% successful, and more to follow. But stay tuned for more information coming on this. And again, when we're ready to launch, we will be sending out information for programs to opt in to participate in the texting initiative. So with that, I think Emily is up next.
Thank you, Jim. Hi, everyone again. Just wanted to provide some childcare assistance program updates for you all. Next slide, please. So the first update is that the new 2024 market rates went into effect on October 1st, 2024. The market rates are posted on the OCFS website at the link listed. Market rates have been set at no less than 80th percentile of the prices reported by providers on the most recent market rate survey. And in some instances, the market rates were set above the 80th percentile to provide a minimum 5% increase from the 2022 market rate. And this allows providers to better meet health, safety, quality, and staffing requirements to really support high quality childcare. The other change to note here is that our market rate groupings have changed. We went from 5 county groupings to 4 in this 2024 rates. So former groups 2 and 4 have now been combined into group 2. Don't forget to provide information on rates to your local Department of Social Service and not OCFS. And we also have a Dear Provider letter posted on our website, and also should have been sent out to you outlining the new market rates and those changes. Next slide, please. And I know we're coming up on time, but just quickly, another update is that in July, New York State launched the Child Care Assistance application. This is an online version of our childcare only OCFS 6025 form. The Child Care Assistance application allows families to apply for child care assistance using a mobile device or computer, and it allows for two-way communication between parents and the local Department of Social Services staff who are making the eligibility determination. It also allows for applicants to upload their eligibility documentation. So they can upload PDFs or pictures of pay stubs, leases, etc., to help with the child care assistance application. So please do encourage your families who may be eligible for child care assistance to use this new option to easily apply. Next slide, please. The other update in child care assistance is that we have been launching direct deposit for child care assistance payments to providers. Phase 1 launched in July of 2024, and we recently launched Phase 2 on October 7th, 2024. The 20 counties listed here on this slide were part of our Phase 2 cohort, and we are anticipating to launch our Phase 3 cohort counties in December 2024. So please visit our website if you are, unsure if what county phase you fall into. And the other thing I want to just mention is that it's a two-step process. So first, you will receive an invitation once your county phase is launched to participate. You must opt in through your FAMS account. And then the step 2 is to enter your banking information in the NYE Pay system. We have lots of resources and trainings on our website and are always happy to answer any questions providers may have around this new initiative. Next slide, please. Also, just want to let everyone know that we put out a quarterly child care newsletter that gives all information about what's happening around our state, what's happening in the Division of Child Care Services to keep you all up to date. And we also have our letters to providers, known as Dear Provider letters, that go out on various topics, and just want to keep you guys as up to date on all of the things. So that could be childcare assistance updates, health and safety updates, but please keep an eye out for those letters. Next slide, please. Just a reminder that we would love for you to send questions or future topic suggestions to us at the email address listed here, and that we do post all of our community conversations. They're recorded and posted on our website. We will be having our another community conversations, not next month, but the month after, following our bi-monthly cadence. We don't have a date scheduled yet for this webinar, but as soon as we have that date scheduled, we will let you know via our listservs, via the unions, the early council, and learning, ECLC, I'm forgetting the acronym. But we will let you all know when that next date is scheduled. Next slide, please. And thank you again for joining us. We will be meeting in December, and once we have the date locked, we will let you know. Really a special thank you to Muja and Nichelle from the Department of Defense for letting us know a little bit more about MCCNY and MCCNY Plus and the militarychildcare.com program. Thank you all for joining us today. We really look forward to our next conversation in December. And with that, I think we are 4 minutes over, not too bad. Everyone enjoy the rest of their evening, and we will talk soon. Thank you.